Welcome to Humanautic, unlocking the secrets inside your body and brain. Humanauts, have you ever wondered how surgeons perform a mastectomy? A mastectomy is a major surgical procedure in which breast tissue is removed, most commonly as part of breast cancer treatment. Today, let's take a look inside the operating room and walk through the procedure step by step. Preparation. First, the patient is placed under general anesthesia. Once the patient is fully anesthetized, the surgical team positions them appropriately and prepares the chest using sterile surgical techniques. The surgeon then marks the planned incision according to the type of mastectomy being performed. Making the incision. Now, the surgeon makes the planned incision across the breast. The exact incision varies depending on the surgical technique and whether reconstruction is planned. In a traditional mastectomy, the nipple, areola, skin, and underlying breast tissue may be removed. In selected patients, surgeons may use skin-sparing or nipple-sparing techniques. Separating the breast tissue. Next, the surgeon carefully develops the surgical plane between the breast tissue and the overlying skin. The breast tissue is gradually separated from the skin and underlying structures. The dissection continues toward the chest wall, where the breast tissue is separated from the pectoral fascia. The surgeon works carefully to control bleeding while preserving structures that do not need to be removed. Removing the breast. Once the breast tissue has been completely freed, the surgeon removes the breast specimen from the surgical field. The specimen is oriented and sent to the pathology laboratory. There, a pathologist examines the tissue to determine the characteristics and extent of the disease and assess the surgical margins. Lymph node evaluation. Now, depending on the patient's treatment plan, the surgeon may evaluate lymph nodes in the armpit. A sentinel lymph node biopsy may be performed to identify the first lymph nodes most likely to contain cancer cells. In some cases, a more extensive axillary lymph node dissection may be necessary. Closing the wound. After the surgeon confirms that the surgical area is adequately controlled, the wound is carefully inspected. A drain may be placed to remove excess fluid during healing. The remaining tissue is then positioned appropriately, and the incision is closed using surgical sutures or other closure methods. Reconstruction. Humanauts, here's where another important step may come in. If breast reconstruction has been planned, it may be performed immediately during the same operation or at a later time. Depending on the patient's circumstances, reconstruction can involve an implant or tissue transferred from another part of the body. And that's the basic surgical journey of a mastectomy, from anesthesia and incision to tissue removal, lymph node evaluation, and wound closure. Remember, Humanauts, this is a complex operation performed by trained surgical professionals, and the exact technique varies from patient to patient. If you found this surgical walkthrough fascinating, hit the like button, share this video, and subscribe to Humanautic for more detailed journeys inside the human body. This is Humanautic, unlocking the secrets inside your body and brain.